Take a look at the Ipass definitions here and use this as your guide when you're going to go through the next handoff that you have today, tomorrow, and forever. The two videos that we're going to be using are being used under the Creative Commons license taken from the classes that they have at University of Michigan. As we begin, follow along and see if you can pick out where each implementation is.
All right. Hey, I have an easy patient for you. This is a 6-year-old with asthma. He failed ED protocol, admitting to Gen Peds. Thanks. What's your pager number?
Hold on, I think we need to do a more complete Ipass handoff.
Okay, fine. He's currently stable. I think he's improving. He has persistent asthma on Dulera at home, but family ran out of it 3 days ago. He's only been hospitalized once before, but he does get like 3 to 4 steroid bursts per year. To make things worse, he had his brother's cold like 2 days ago. Family used albuterol at home, but he really started wheezing today, so they brought him in. He was afebrile, but tachypneic to like 28. He had suprasternal, subcostal retractions, not moving air well, not wheezing. The rest of his exam was okay, so we gave him 3 duonebs, loaded him with methylpred. Still tight, so we did continuous for 3 hours, mag once, and then he finally broke. We were able to space him to 5 milligrams of albuterol every 2 hours, and he got that twice. Now he's breathing comfortably, but he's definitely wheezing around that 2-hour mark, but his sats are fine. I do kind of worry because this is only day 2 to 3 of this viral illness, and he could get worse, but he seems okay on Q2 right now, and he was able to eat a turkey sandwich a little bit ago. All right.
Does he have any other medical conditions? Are there any other meds he takes?
All right. No other conditions, just the asthma. Yeah, Mom says he gets allergies in the spring. I didn't ask all the meds, but it seems like he didn't take too many.
How about surgical and family history? Who all lives at home? Can you do a med rec?
Yeah, you know what? I didn't get into those very much, but I think you can probably handle those things upstairs.
You're right. I'll summarize what I know. Sounds like this is a 6-year-old with moderate or severe asthma who's getting admitted for asthma exacerbation secondary to viral URI, and also medication noncompliance, who needed continuous albuterol, now spaced to Q2, and also MAG once, but is currently in no respiratory distress, breathing room air between treatments.
All right, yep.
Okay, my pager is 12345. He's getting admitted to the blue team. Thanks.
As you can see, sometimes the way we talk doesn't always fit exactly in the way that Ipass is written out. In this next video, apply the labels yourself to each aspect during the sign out. Take note to which areas could be improved and how to structure the sign out to flow better.
Hey, I have an admission for you. He's definitely sick, but not ICU level. This kid, he's a 6-year-old, ex-26 weeker. He has a history of seizures, but he's only on Depakote at home, and he's G-tube dependent. He started vomiting and diarrhea a couple days ago after his older brother had the same thing earlier in the week. Yesterday, he started having more seizures. It was like 3 in 24 hours or something like that. Normally, he only has like 1 per week, but they're like exactly like his normal tonic-clonic seizures, and they lasted about 10 seconds. But his parents noticed this increased seizure frequency yesterday, so they brought him into the ED here today. Here, he's been afebrile, but he's tachycardic to the 120s, so we bolused him twice, and his tachycardia got better. Still vomiting a little bit, so we held feeds. And he's no longer seizing, but he does seem really sleepy. His belly's soft, G-tube looks okay, no rashes anywhere. We got a BMP and a CBC, and they were okay, and his abdominal ultrasound was normal. We talked to neuro already. They wanted us to load with IV Keppra and admit to Gen Peds because of his viral gastro. They didn't want an EEG because the episode seemed like it was provoked. They did say that if he starts seizing again, to reload with the same dose of Keppra, and that they would be happy to be on as a consultant. Do you have any questions?
Anybody else sick besides his brother? Does he go to daycare?
No, nobody else is sick. I didn't ask about daycare.
The story sounds pretty straightforward. Just a couple things. Could you start maintenance fluids? Also, can you bump that BMP to a comp? I just want to make sure nothing crazy is going on. Also, can you get the pharmacist to do a med rec?
Sure, yeah, we can start fluids and complete the labs. I think our pharmacist is pretty busy in the resus bay with someone though, so I don't think they can do a med rec right now, sorry.
You know what, that's fine. We can do the med rec. So basically, he's a kid with seizures and G-tube dependence who's getting admitted for rehydration and seizures secondary to viral gastro. His seizures have stopped after copper and IV fluid boluses, but he's still vomiting, so he needs to stay at least overnight. Anything I missed?
Nope, that's about it. Great.
Okay, he's going to Gold Team. My pager's 1234. Thanks.
That concludes our video session. Thanks for taking 5 minutes out of your day to become a better doctor and also ensure better patient care. Keep this Ipass mnemonic close to you or on you at all times, so when you're signing out to another resident, another physician, or any other staff, you make sure you include all the important aspects, providing our patients the best possible care.